You're welcome to another edition of my program called Health Talk with Queen Nikki. Health Talk with Queen Nikki. Have you guys subscribed to my IG account? It's called Health Talk Queen. Have you followed me? Subscribe to my TikTok account called Health Talk Queen. Or have you followed me on YouTube called Health Talk Queen 1? Health Talk Queen 1. Like, share, download, repost my work so your lover ones out there can enjoy the yummy tips that I'm bringing. Today, what's going to be our topic? It's going to be self-medication awareness. Self-medication awareness. It's a big topic. Okay, the reason why I'm bringing this topic to you guys is I got an inbox on TikTok, like a lot of them, like 10 of them. They were like, Queen, why don't you like to mention the medication when you do your health, video? And I was like, okay, I will do a video concerning that. Okay. Now, the reason why I don't mention medication in on my video is due to various reasons. Number one, I am a nurse, and the responsibility of a nurse is to teach, to teach prevention. That's what to let people be aware of the disease process, how they can even prevent it before it occurs. Okay, even though if it occurs, what are the things that we can do to teach our a patient or our followers as the nurse? Now, for me to be able to say medication online, you have to have license to be able to say that. There are some nurse practitioners, they call them advanced nurse practitioners. They are licensed to talk about medication, and also a medical doctor or pharmacy, they have ability to talk about medication. Now, that doesn't mean I cannot mention medication. I can do that. If you email me privately, we can talk about medication. But medication that I'll be talking about is going to be side effect of those medications sometimes, or what to watch out for, or the teaching that associate with the medication. Now, let's go to a consequence of self-medication. This particular set of people, they live in Africa, mostly Nigeria, and I'm trying to bring it across. Now, I noticed that when they're asking me question about any disease process like hypertension, diabetes, the next thing they'll be like, oh, I go to the chemist. Chemist is the pharmacy, local pharmacy that they purchase medication. Oh, and I go there and I purchase medication. This is very harmful, because sometimes you might think you have malaria, but it might not be malaria, it might be diarrhea. It might not be malaria, it might be typhoid. So why are we buying medication that is meant for headache, and then we buy medication for cancer to treat headache? This is what I'm talking about. That's why you need to go to your doctor for them to prescribe this medication before you start taking it. Because number one, there are some medication that they have to check your liver enzyme or your kidney function, or to assess you to see if you are able to take those medication before you can take the medication. But if you decided that you want to go to the pharmacy and just purchase medication, you're going to be in trouble. You're going to put yourself in trouble. So let's know what is going on first by going to your primary care doctor, and then let them prescribe the medication. Then you take it to the pharmacy and buy the medication. If you damage your kidney or your liver due to medication, wrong medication to treat the wrong thing, trust me, the consequence is not funny at all. And you don't want to do that. You want to avoid that. And there's some medication that maybe the doctor will prescribe, take 3 times a day, but the pharmacy will tell you, oh, take it 2 times a day. Take it. Trust me, and most pharmacy, don't quote me, this is experience. I lived in Nigeria before I came to United States, right? I was born there. Some pharmacy there, those people that are pharmacy attendants don't even know what they're doing. They don't even know what they are doing. Some of them are not even pharmacy, registered pharmacy. They are like apprentices that they become, they're selling medication to people. So y'all be careful out there. If you want to go to a nurse, like the local nurse that have a shop. That one is preferable, but make sure you ask for the nurse license to make sure it's the licensed nurse, not auxiliary nurse. Auxiliary nurse is different from licensed nurse. That I'll be telling you guys the difference later on, especially for those in Nigeria, because auxiliary nurse, they are just nursing assistant. They are just assisting the nurses. Okay, they are not licensed to prescribe medication or licensed to give medication or licensed to even buy medication from their hand. No, 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 no. The people that you can even buy medication from or to treat you in Nigeria, they are the licensed registered nurses, and you can politely ask them, are you licensed to take care of me? Because you don't want to fall into quack. We call them quack nurses. Okay, you don't want to fall in. These are the things you need to pay attention when it comes to self-medication. Okay, but the best bet is go to a clinic. We have local clinic, local hospital. You don't have, if you can afford private hospital in Nigeria or Ghana or South Africa, go to the government approval. I know things are not right in, I know, I understand, but trust me, we still have to believe the system. We still have to trust the system. Go there, make sure you see the doctor physically, and then ask for the right prescription and take it to the pharmacy, and make sure you look at the pharmacy. Are they licensed to sell drugs? And when you're taking the drug, please make sure it's the real one with NAFDAC approved. NAFDAC approved, or the barcode that you guys use to identify correct medication in Nigeria. Very important. You don't want to make sure it's the right medication, it's the right dose, and you're giving it the right route. If it's the medication that you're supposed to take by mouth, you take it by mouth. If it's the one that you have to insert through your rectum, you do that. If it's the one that you have to inject yourself, with the help of the nurses, yeah, that's what I mean by right route, okay? And the right timing. If it's the one that you have to take in the morning, don't go take it at night, So self-medication, that's why I'm emphasizing. Multivitamin, yes, you can go over the counter and buy multivitamin, especially for us female. Yeah, because we do period every month. We need to replenish ourselves. So multivitamin is over the counter. You can just go there and purchase good one, okay? With lot of folic acid in it. Okay, lot of folic acid, especially for young bearing woman. Okay, what's it called? Also, make sure you can buy other multivitamin for elderly, for older people. That one you don't need prescription for that. That's what I'm trying to say. But the key thing is, health is wealth. You don't want to damage your body. If you're sick, please run to the doctor. Run to the doctor. Make sure they give you the prescription medication, because it can damage your system. There are some medication that can put you into shock. Shock means it can shock your system. Please, you don't want to do that. It can damage it. I know of certain medication that you would take, it will shut down your kidney. And kidney, those are vital organs. Even destroy your heart. Be careful. Self-medication is a no. Except multivitamin. Except maybe over-the-counter medication. Let's say you're having headache. In Nigeria, you take paracetamol, it's fine. Or you're having headache. In United States, you take Motrin, over-the-counter, Tylenol, over-the-counter. That's fine. That's okay. You don't need doctor prescription for that. Okay, but please, the other ones that you need prescription, especially antibiotic, that's my target. Be careful, because there are some that the doctor need to be careful before they prescribe. If you have allergy to medication, they will never prescribe that for you. That's why you have to be your doctor's friend. I know. See, you can prevent all this thing by just pay shipping money for the doctor's visitation and buy the right medication, or go buy the wrong medication and shut down your system. Okay, I hope this helped, and if it helped, let me know. If you want me to do more, elaborate on it, I will do it. Till I see you guys in my next video, remain blessed and have a wonderful day.